how the HIV is transmitted to a healthy person. Transmission can be done via blood or semen. Mainly, as I told before, HIV is transmitted via blood and semen. Transfusion of infected blood, that means blood of infected person or the blood products. Transfusion of the blood, bone marrow, even it is done. So transfusion of blood or bone marrow or blood products, transplantation of the organs from the infected person, from an infected person, use of contaminated needles or syringes that are used for injecting the drugs or chemicals, the use of the contaminated razors at barber's shop, boring the ear pinne or nose with the contaminated needles, artificial insemination if it is unchecked, if not checked for HIV. That means artificial insemination should be done after HIV testing. Without HIV testing, you can write down artificial insemination without HIV testing. Without HIV testing. Even the transfusion of the blood, transplantation of organ, that should be done after testing for HIV. Sexual intercourse with the infected partner without using a condom. Using a condom, there is no risk, but without using, then from infected mother to child through the placenta, because the HIV can pass through the placental barrier. And where the AIDS cannot be, AIDS virus, that is HIV, cannot be acquired. How it cannot be acquired? By insect bite, it cannot be acquired. Crowded transport, when you come in contact with the other person in a crowded transport, or by shaking hands, sharing the towels or the clothing, coughing and sneezing. It is not a droplet disease, okay? Coughing and sneezing, kissing and embracing, sharing utensils or the use of the telephones or other articles like computer, pen, pencil, etc. It is not acquired by using the swimming pool or toilets used by the infected persons. Write down all the points. On the entry of the pathogen, the body gives response by producing large number of antibodies. But the incubation period is 6 months to 10 years. The expression, the pathogen remains unsymptomatic. First of all, that symptoms, how they are shown, the acute infection stage, clinical latency and AIDS related complexes are shown. Then full blown stage is there. In acute infection stage, within 2 to 4 weeks, means after a few days of infection, after the entry of the pathogen, the person shows, the infected person develops flu-like conditions. Flu-like conditions like sore throat, that is the inflammation in the throat. Then even the headache, develop the headache, swollen glands, or headache. But these symptoms are not persisting for a long time, for a few days. Then again the clinical latency, clinically unsymptomatic it remains. Virus is replicating in a, means what is latency? That is the unsymptomatic period where The virus is replicating in host cell without expressing the symptom. AIDS related complexes, the next stage. The recurrent chronic diarrhea. Even here, the diarrhea is also seen, diarrhea for a few days, then undergoes the latency period. Then recurrent or chronic diarrhea, pneumonia, persistent cough, continuous cough, the weight loss and unexplained tiredness, and prolonged swelling of the lymph glands and in the armpits, the groins and the neck region. The swollen glands, lymph glands are shown, remain. Then fever, night sweating, sores of the mouth, anus and the genitalia, external reproductive part. Okay, in these regions the wounds or the sores, inflammation, the mucous inflammation occurs. The inflammation of the mucosa lining occurs. Then it comes to the full blown stage. Write down all these points. So infected person suffers from the various pathogenic. In full blown stage, what happens in the last stage is then as the T lymphocytes are destroyed, the person is open to contract different type of diseases, that fungal or bacterial, other viral or toxoplasmic that we have discussed earlier. They are open to any type of disease, and this infection that leads to infected person different type of infections. That is fungal, viral or the other toxoplasmic, etc. Okay. Then here the T lymphocytes already destroyed. Due to the infection, the person that white patches in the person's skin, white patches on skin develops, white patches. Okay. Even the dementia develops due to damage of nervous tissue. The memory loss, dementia occurs. Okay. Diagnosis. How it is diagnosed? The diagnosis can be done by the ELISA. The diagnosis, AIDS can be diagnosed by ELISA and Western blotting test. How the diagnosis is done? By ELISA. ELISA is a diagnostic test. ELISA enzyme linked immunosorbent assay. Then Western blotting test is done for confirmatory. Diagnostic test is ELISA, and Western blotting test is the confirmatory test. It is the confirmatory. Is done. After it is diagnosed, the ELISA comes positive, then the confirmatory test, the Western blotting test is done. The treatment, as we discussed, the symptoms are having the different stages, mainly 3 stages. That is the initial stages, that infection, acute infection stage, due to the production of antibodies, increase in number of antibodies, the body develops some fever, that sore throat or inflammation, and in the latency stage, the person remains unsymptomatic. During that period, if art is done, if done from the latency stage, then the person can survive, can live for decades, years together, because latency may extend for about 10 years. Then at the end of the latency, when the AIDS complexity increases, AIDS related complexity increases, suddenly the person gets infected by different diseases, because during the arc, that is AIDS related complex stage, different diseases, because they are open to different infections caused by the different pathogens, and the T lymphocytes in which is during AIDS related complex or simply AIDS stage, okay, it is called stage. What happens? The T cells, helper T cells, decreases, okay, decreases or fall below 200. The T cell count becomes, helper T cells count becomes below 200. Okay. Combination of medicines is known as ART. What is ART? Antiretroviral therapy is called ART. What is ART? Antiretrovirus. The HIV is the retrovirus, so antiretroviral therapy. Why it is retrovirus? Because it consists of the reverse transcriptase enzyme. Retro means back. Actually, the reaction is like that, from DNA to RNA, RNA to protein synthesis. That is central dogma. Always the nuclear material follow the central dogma. What is central dogma? This follows the one-way method, that is DNA to RNA, RNA to protein synthesis, protein. Here the transcription, what is this? Transcription. What is this? Translation. But here what happens? From RNA to DNA occurs. Viral RNA to DNA first. This is reverse transcription. And that what happens? Goes backward reaction. It is the backward reaction. That's why retro. In this way, RNA to DNA, which is here we can put When it occurs, this is reverse transcription. If this one is transcription, DNA to RNA, then RNA to DNA is reverse transcription, backward. Retro means backward. So, retrovirus. So, antiretroviral therapy. A combination of medicines are used, which is called antiretroviral therapy. If it is started from the latency period, then one can survive for a long years together, decades, multiple of 10. Drugs fall under 6 classes. Some effective drugs are, they are the dextran sulfate, which inhibit the binding of the virus to the cell membrane. Inhibits the binding of virus to host cell. Zidovudine, azithromycin, they act as the reverse transcriptase inhibitor. Means inhibit the function of reverse transcriptase enzyme inhibitor. And zidovudine is the drug of choice. It is the drug of choice for AIDS. The dioxycytosine and the phosphonoformate, these two are also used for the reverse to inhibit the reverse transcription. These two also inhibits the reverse transcription. Okay. Prophylaxis, prevention of AIDS. How the AIDS can be prevented. No vaccine has been prepared yet. No vaccine is yet prepared. Yet developed. December 1st, the World AIDS Day is observed. December 1st is observed as World AIDS Day. AIDS education is given. Even the NACO, National AIDS Control Organization, the non-government organization, they also educate the people about the AIDS. So, ignorant people are, to the ignorant people it is said that don't die of ignorance. Blood test should be done for HIV of the blood donor before transfusion. Before transfusion. Blood test should be done for HIV of the semen donor before artificial insemination. The blood test should be done for HIV of organ donor before transplantation. Before transplantation of organs. Of organs like kidneys, disposable needles or syringes should be used and they must be destroyed after use. Sexual relationship should be monogamous. The sexual relation should be with single partner. Avoiding the tattoos, ear and nose piercing by the unqualified person, from the unqualified persons. Avoiding the use of blades and contaminated. Avoid the use of blades, common blades and common blade in barber's shop. Yes, students, what we discuss in this session? We discuss about the acquired immune deficiency syndrome caused by HIV, human immunodeficiency virus, which was discovered by Francois Baer, Shinoshi and Luc Montagnier in the year 2008. They were received the Nobel Prize for the study of AIDS research, for doing the AIDS research and prevention. They have also discovered the virus causing the AIDS. The AIDS is transmitted through the blood or the semen from the infected person to healthy person. The diagnostic test is ELISA, ELISA, enzyme-linked immunosorbent assay. And when the ELISA comes positive, the Western blotting test is done for confirmation. So as we came to know that it is transmitted through the body fluid like blood and semen, we should be always aware of this and we should take the preventive steps. And as we discussed the prevention is better than cure. Okay, some people are ignorant. For them it is told that don't die of ignorance. And this awareness is created by the NACO, National AIDS Control Organization, the NGO, the non-government organizations. The December 1st is observed as the World AIDS Day. The main motto to create the awareness among the people. So, we should follow the preventive steps. Okay, thank you.